COVID-19, and time is of the essence. We're going to tell you all about convalescent plasma. If you've never heard of it before, what it does, why it's so important, and why time is of the essence. We are all concerned about the impact that this virus is having on our community right now. And as we wait for a vaccine and we wait for new therapies to treat COVID-19, we are hearing that convalescent plasma is one option that can really help a lot of people who are fighting this virus. So right now, we want to bring in the Blood and Tissue Center Foundation chairs, Jenny and Art Bennert. Thank you so much for joining us, guys. Take it away.
Thank you, Delane. My name is Jenny Bennert, and my husband Art is also attending, and we are the 2020 chairs of the Blood and Tissue Center Foundation. On behalf of the foundation, we would like to welcome you to the Voices of Hope Lunch and Learn series. As some of you know, the Voices of Hope Lunch and Learn series was created by the foundation to help raise awareness of the important work at the South Texas Blood and Tissue Center and the role it plays in helping to save lives in our community. Today we will hear about one very important program that was launched in response to the COVID-19 crisis, the Convalescent Plasma Program. You will learn about the ever-evolving research and science behind it, the treatment protocol, how you or a loved one can donate, and what it's like to donate. Before we start, though, I'd like to thank the staff at the BioBridge Global for all the work they did to make this webinar possible. I would also like to thank our esteemed presenters, Gordon Hartman, Paul Basaldua, and Elizabeth Waltman, who are passionate about this project and willing to take the time out of their busy days to explain how it works. Finally, I would also like to extend a special thanks to Delane Matthew, our moderator. Many of you know Delane as the co-anchor of News 4 San Antonio Evening Show. She is also a person with a very generous heart, and for those of you who do not know, she is also a fabulous dancer. Last year, she was one of the dancers for our Red and White Ball and raised thousands of dollars for the foundation. And so we're very grateful that she has taken the time today to help us once again. With that, I will turn it over to Delane. Thank you for coming and enjoy the webinar.
Thank you so much, Jenny. We appreciate that. Okay, so here's how this is all going to work today. Really, we want to hear from you. We want to hear all your questions, and we have our panelists here to get you some answers. But we also have a few people here who have lived through COVID and who have donated their plasma or are in the process of donating their plasma. So that's why we're all here today, to find out more about this liquid gold that we all have in this pandemic right now. So during today's session, attendees will be in listen-only mode, although registered WebEx participants may submit their questions online during the session. We are not using the chat bubble icon for questions. Instead, please type your questions into the Q&A panel right there on the right of your screen. Now, if it does not automatically appear for you, if you don't see it right now, here's what you have to do. Are you ready? Click on the circle with the three little dots for more options, and then click on Q&A. You can type in your questions into the dialog box and then click the send button. Now, for me, that's going to show up on my right-hand column. And during the process of this entire session, I'll be kind of glancing over there, keeping an eye on your questions. Also, we have an administrator who's keeping an eye on your questions as well. So if one of our panelists happens to mention or answer one of those questions, she's going to tell me that that's been answered. But if you want to hear it again, let me know, and I will absolutely keep an eye on that. So if you are in split screen mode, the Q&A panel again is open. It's located on the lower right side of your screen. As a reminder, this presentation is being recorded right now. It is also streaming live on the Facebook page for Connect for Life, and I believe Channel 4, News 4 San Antonio's Facebook page is also streaming that live as well. So welcome to all of you, Facebook world. Super important topic that we have to talk about today. So we're going to get started here. A few important speakers we have. First of all, Gordon Hartman. You may know him. He's well known in San Antonio and beyond as the founder of Morgan's Wonderland and the Gordon Hartman Family Foundation. Since 2005, this foundation has committed more than $60 million in this community for the betterment of the people with special needs. He's here today as someone who has recovered from COVID-19. So glad you're healthy and safe. and who have committed to becoming a convalescent plasma donor. We're going to pick his brain about that in just a minute because I believe you're going through board in the process right now. Paul Vasagua, the president of Versaterra Development. You have had COVID yourself, Paul, and you know several others who fought the virus as well. I know that News 4 San Antonio did a piece about you, and we are so proud of you and what you're doing in this community as well. He became one of San Antonio's first COVID-19 plasma donors, which is why we interviewed him. And now he's dedicated to advocating for this program. He is leading an effort to rally San Antonio to fight the pandemic and to provide support for underserved communities through the Con Corazon initiative. So we appreciate you, Paul. We're going to pick your brain too. And Elizabeth Waltman has more than 40 years of experience in blood center operations and management here. Elizabeth began as a labor and delivery nurse and has transitioned into blood banking, serving in many, many roles. And now as the Chief Operating Officer of the South Texas Blood and Tissue Center. Thank you so much for being here with us today. And you are going to help explain what convalescent plasma is, what medical experts are saying about this, and why it is so important. So I want you to kick us off about all things convalescent plasma. You see firsthand all the people who have recovered. I saw Metro Health yesterday, it's 89.5% of people who have had this virus recovered from the virus. That's an awful lot of people walking around with help in their veins. So tell us about the need for convalescent plasma, Elizabeth.
Thank you, Delane. It's a pleasure to be here today, especially with our other guests who are making a huge difference in this community. Convalescent plasma is plasma that we collect from individuals who have recovered from COVID-19. So as you said, there's a lot of people that are walking around that can help other people who are suffering in our local hospitals. In fact, what we see is that when people come in and donate convalescent plasma, they can help 3 to 5 other individuals who are in our area hospitals. So it's really important that if you've had COVID, that you contact us and let us see if you can help another person. Convalescent plasma in the past, so people say, well, how do you know this will work? Well, convalescent plasma has been used since like the late 1800s. They started with treating individuals who had diphtheria with it. And then when the Spanish flu hit, which was the other one where 200 million people died worldwide, they used convalescent plasma back then. They've also used it for Ebola. They've used it for measles. The thing that's exciting now is that we have this very large clinical trial that's in place where people who donate convalescent plasma and the plasma is being transfused to patients, all of that information is being collected by the Mayo Clinic, and they are putting together a huge trial with a lot of information. It's going to give us some specific information about how this particular type of treatment will work.
I'm thinking myself there. So, first of all, the reason convalescent plasma is considered liquid gold right now is because of the antibodies it has, right? So explain to everybody how antibodies work. They're like little soldiers that fight off the virus, right?
That's a great analogy because they are like little soldiers. So when someone has an illness that's caused by a virus or a bacteria, the body's immune response is to create antibodies. And those antibodies are specific for whatever the antigen is. So the antigen is COVID-19, and the antibodies, the neutralizing antibodies, will actually go out and wage war against that virus. So it gives the body a jump start on its recovery. It's a passive immunity. So active immunity is what happens when you get the virus and you develop your own antibodies. Passive immunity is when we take the convalescent plasma from one person and we give it to another one. Now, once we've given the convalescent plasma to a patient, that is a passive immunity, which means it doesn't last forever. But it does give that patient a head start on their own immunity, and that's why we want to give it earlier in the process.
So in simplest of terms, in layman's terms, so once someone is battling COVID, they would take this plasma, infuse it into the system, and then all those antibodies will start fighting that person's virus immediately, right?
Absolutely
Now,
correct.
I read also the mortality rate is drastically cut down for people who receive convalescent plasma. Is that correct?
What the Mayo study is showing is that when people get convalescent plasma earlier in the process, their ability to fight the virus is much higher than those who don't get it. Yes.
So why is time of the essence for somebody who has recovered from the virus?
So the antibodies in the blood don't remain at the really high level for a long, long time. The way that the body responds is that, much like your analogy with soldiers, is that when the virus or when the bacteria invades the body responds to it. So they send in all of these troops to essentially work to eradicate the virus. And then after their work is done, essentially they diminish in numbers. So you only have a small amount left in case the virus ever shows up again. The body's ready to fight it the second time. But the amount of antibodies that are left may not be enough to essentially have a therapeutic dose for someone else. So what we're seeing is that after someone gets COVID, there's about a 30, 60, 90-day period of time where we really need to get the convalescent plasma during that time and get it transfused to someone else. Now, we do have what we call super donors, where that level of antibody remains high for a much longer period of time. But that is rare. That's not very common.
Is there a window, because we were discussing convalescent plasma the other day, and I thought, how come it's not mandatory for hospitals when a COVID patient, before they're admitted and they're filling out their paperwork, why isn't that a question on the admittance letter in the information? Before you leave, you must be a convalescent plasma donor. If it's the only thing we have therapeutically right now, we do have remdesivir. That's expensive and it's few and far between. So the one thing we have going for us right now in the way of a possible therapeutic is our convalescent plasma. So why isn't it mandatory out there in the public that people who are diagnosed with COVID, whenever that window passes and they're able to give their convalescent plasma, how come that's not mandatory in the community yet?
Well, at least as a citizen of the United States, it's nice that things aren't mandatory like that.
Yeah.
People get to make a choice, and we hope that they would always make a choice to help their fellow citizen, their fellow U.S. citizen, to recover from convalescent plasma. But keeping in mind, people who can donate convalescent plasma, they also have to be qualified as a blood donor. So not only do you want people who have the antibodies, but they also have to be able to give blood, because it is a biologic. It is going to be transfused into another person. And we certainly want people of their own free will giving plasma, because we know that they will be answering the questions honestly and correctly, so that there's no injury either to them or to the patient who's receiving the plasma. Now, one of the things that I will say is that our hospitals have been working very closely with us, and they have been talking with patients and with their families and saying, if you know somebody who has had COVID, would you please consider donating? So I think the hospitals are trying to help us in that respect.
Just get the word out. Because
yes.
Maybe people don't even know that this is an option, which is why we're having this session. I'm going to go ahead and I'm going to ask this question here because I think, Elizabeth, this is probably going to be good for you. How are patients selected? This is by Randy Bohr. How are patients selected to receive the plasma? Who makes that decision when not all can receive?
So it's ultimately the physician and the family's decision. I think together they're making the decision based on the severity of the disease. Now, one of the things that we are seeing from the Mayo study is that when convalescent plasma is given earlier in the process and the antibody level is at a certain level, that the patients are having a better outcome than if it's given later in the process and the antibody levels are lower. So we do have some physicians that essentially say, if the patient is sick enough to be in the hospital, we want them to get the plasma. There are other physicians that are a little bit more conservative. So it really is a patient, family, physician decision.
All right, well, let's talk about some of the people who have made that decision. Let's move on to Gordon. Hi, Gordon. How are you today? Well, first of all, we're so glad that you're healthy and you have recovered from the virus. How did you learn about convalescent plasma, and when did you make the decision to give it up?
Well, a couple things. First of all, thank you, Delane, and everyone who's on this opportunity to learn more about this. I think this is such an important subject right now. I had heard about it, but then also Paul, who's going to be speaking in a little bit here, is somebody who I found out through a friend that he was very involved in wanting to promote this. At that time, I had not come down with COVID-19. I just knew about it. And then about 40 days ago, I came down with COVID. And, it's one of those things you just don't think is going to happen, then it happens to you. And went through the process, and it was a couple weeks of pretty intense, not feeling too well. And as soon as I came out of that, I wanted to give back because I feel I'm really blessed that I did not get the major effects of COVID-19. When you hear about people being on ventilators, when you hear about people being in ICU, people being in a hospital, people really having a tough time with this. And I was one of the blessed ones. And so in some way, I feel very much it's in some ways my duty to, now that I'm feeling better, that to give back. And when you look at the statistics on this, and that there's a need for 75 donors daily, and we're only bringing in 30, we've got to get more information out there. We've got to be more involved in the community, because there are people right now, as we're talking here, who are in the hospital who maybe could leave the hospital if we get more information out and more people become donors. And so if I'm going to talk about that, then that's something I really believe that I need to show it by giving. And that's why I'm so much behind this effort and want to do everything I can. I hope I'm one of those super donors that Elizabeth talked about. I don't know if I will be, but if I am, I'll be happy to give as much as possible.
Yeah. So tell me about the process. What have you done so far?
Well, it's been easy. I filled out a form that they sent me, and first I contacted them and said, hey, I'd like to be involved in this, and sent me back some information I electronically had to send back, and some conversations went back and forth, and now we're ready to proceed forward. So it's not a difficult thing to do. I think, honestly, the reason that there's not more people involved in this is they think, number one, it's going to be difficult, it's going to be very time-consuming, and it's so much more difficult or harder than just giving blood. And none of those things are true. This is a simple thing to do to help a lot of people. And so I think once that message gets out in a more aggressive fashion, hopefully we'll see more people being involved in that.
Well, Gordon, when it comes to the numbers, we see the numbers every day. We have them on the newscast every single day, and we're beating them into people's heads. 44,000 cases so far. They're counting more than that. And then you see the numbers of recovery. There are thousands of people who have recovered, thank goodness, from COVID-19. And just a drop in the bucket are actually donating. So, do you see yourself, now that you're an advocate for this program, how do we get the message out other than by sessions like this? What else can we do in the public to get people to understand that what they have could really help other people?
Well, I think it's just a matter of just being out there and talking. One of the things is what we're doing here, and hopefully as this goes forward, I want to do what I can in any way to publicly participate in saying, hey, this is something that needs to be done. When we talk about 45,000 people, I don't know the exact numbers that have recovered, but I'm going to say it's probably between 25 and 30,000. If we're needing 75 people to come in on a daily basis, and we look at that on a weekly basis versus the number of people who are out there who could participate in this, we're sometimes even hitting double digits in respect to the percentage of people who have helped. And so I'm sure there's a lot of people out there that want to help, they simply don't know. And so we're going to just have to become more aggressive, I believe, and hopefully between what we're doing today, along with what Paul's already done, along with Elizabeth being able to do what she's doing and really describing the benefits of this, and then people recognizing that this is not a difficult thing to do. This can easily be done, and by doing something that's really quite easy, you help a fellow man, a woman who's in the hospital who needs to recover from this. And I always say, I've often said this about my situation on this, is that I was one of the lucky ones. And so if I'm one of the lucky ones, I want to give to those who maybe are less fortunate in this. And I think as that word gets out about how easy it is, and more people who say, hey, I was able to beat COVID. Yeah, it was not a real easy thing, but it was nowhere compared to those who are in the hospital or on a ventilator. Well, then I need to do something about that. So just getting the word out. It will happen. And we just need to put more and more information out there in the public.
Well, that's what we're doing for sure today. So a quick question for you. Someone wrote here, Ken wrote, how long time-wise does it typically take to donate convalescent plasma? I think that seems to be one of the caveats for a lot of people, is that I've just recovered from this virus. I'm exhausted. Now I got to get in my car. I got to go over to the blood tissue center. I got to sit there for hours. Explain the process. How long does it take? What do you do?
Okay, well, first of all, in respect to COVID-19, I'm still tired. I'll be honest with you. I'm still having some of the little effects from it, and I'm still getting chills every once in a while. Paul shaking his head. He knows what I'm talking about.
Yeah.
This thing doesn't totally go away just immediately. You still have, every once in a while, it kind of comes back and reminds you, hey, I was there. And but I will tell you, the process takes an hour and 15 minutes total. It's not a long process. It's nothing that's more complicated. There are a few more things that need to be done than just giving blood. But I mean, it's not a difficult process. And when you think about how easy the process is compared to the degree of what it does to help someone, they're not even close. I mean, it's not even something that really, as people learn the information on this and they see it, it becomes so immediate that you've got to get involved in this. And so that's why I'm just really trying to overly emphasize the fact that we have an opportunity to help so many people here in San Antonio. And it's just a matter of getting the information out. Because if it was a all-day process, or a process you had to go back numerous times, or it was something that is very cumbersome or whatever, then I could see where maybe less people might be involved. But it's nothing like that. This is a simple, easy thing to do to help people really be able to turn their lives around much quicker, and hopefully get out of the hospital much faster.
Gordon, do you know anyone who has received your plasma yet?
Actually, I have not actually. I have fully engaged myself in the exact process because I wanted to understand it. So those comments I made are based on that information that I have received. I actually don't am involved in that process until next week.
Oh, good. So next week is when you start to actually give your plasma. All right. So, all right. Let's move on to Paul. Paul, you were one of the first in San Antonio to actually donate your convalescent plasma. Tell me your story. When were you diagnosed, and how did you even hear about convalescent plasma? Tell me it was on the news. Oh, you're muted. Unmute.
Sorry about that. Actually, it was my wife who twisted my arm. I was still feeling a little sick, and she said, "You got to figure out how to give back, whether it's donating blood to somebody that's working on a vaccine or plasma." But my story is I think I was 24th or the 25th person in San Antonio to test positive for it. I just woke up one morning and I felt like I had been run over by a bus. Like Gordon said, I was very lucky. My symptoms were pretty mild. I had a little bit of fever for a couple days, and then the body aches, started going away on day 5 or 6. So very, very lucky. And so, while I was sitting in my house quarantining, and my wife came up to me one day and said, "Would you be willing to give blood or donate plasma?" And I said, "Absolutely." Right around the same time, a really good friend of mine, Claudette Guerrero, her uncle had gotten really sick with it. And his name is Joe Doria. He's the second person that's ever received plasma locally. And so she called me and asked if I could start going through that process. And at the time, since I was one of the first ones, it was you had to wait 28 days after your last day of symptom to give, or wait 14 days and come with a negative test in hand. So I scurried to go get another test done, and they got my results back, and I was negative, so I was able to give. Now, unfortunately, he took a turn for the worse, and it was right around Easter, so he got his plasma from somebody else, but he made it. That's the fortunate part, and if you've seen him on TV, he's full of life and energy, and he's a great advocate for what we're all doing. So yeah, I gave right around the end of the first week of April, and I've been able to give 5 times since then, and I hopefully will be able to give a 6th time. But every time you go in, they test your titers, which is your level of antibodies, to see whether or not you've hit that floor that you need to meet the requirement to be able to give. And so hopefully I have 1 or 2 more left in me, and that's pretty much my story.
You've given a lot of plasma. So, I don't think people realize that you can give more than once. As long as your antibody level maintains a specific level, then you can keep giving. So, you've said you've given 5 times, you're going to try to do a 6th since April. So, and I think, Elizabeth, this might be a question for you, and I'll circle back for you in a second. I'm going to continue with Paul, but I want to find out that window, because, Paul, how soon after you recovered, and you mentioned it with some of the tests you had to take, but and I wonder if that's changed too, so how soon after you recovered were you given the green light?
It was right around 14 days after my last day of symptom. And I think that's still the CDC goal or requirement at this point. But there's no need to have to be tested out anymore. You just wait that 14 days and you can go start the screening process that Gordon mentioned he has started.
Now tell me about the screening process. What do they want to know?
When your last day of symptom was, whether or not you had I don't know if it's the same, and Elizabeth can correct me if it's changed, but they wanted proof of my positive test on the front end. And then that's pretty much it. You call, you set up a time to go by, they take your titers. When I went, they actually took plasma out of me that first day, but told me very clearly, we got to test your blood to make sure that there's nothing going on there that would keep us from donating it or giving it to a recipient. And those tests will come back in a day, and we'll call you back and let you know. And so they called me back the very next day, and they said, everything was good. Your plasma units are off to several different local hospitals, and when do you want to set up another meeting to come back? So.
Well, and does it hurt?
No, not at all.
Just lay there for an hour and a half and go to sleep.
You lay there for an hour and a half, and you joke around with their great medical staffs that they have over there, and you talk COVID and you talk plasma, and it's very easy. You lay in a chair, they hook you up, to take the plasma and the blood out, and then they put the plasma, or they take the plasma out, they put the blood back in with saline so that your blood doesn't clot. So you leave feeling exactly the same way you came. And Gordon alluded to it, but back when I was giving the first time, it took roughly around an hour and 45 minutes. But now we get in there and we all joke around that I know all the answers to the questions that I need to fill out, and we kind of time it. So the last time I went, I was out of there in an hour and 10 minutes. Yeah, so.
Well, super dumb.
They've gotten more efficient, everybody's gotten more efficient.
Yes. I think we are all getting more efficient in this COVID thing as the months go by. So, Elizabeth, let's circle back to you. Let's talk about that process as you unmute. Now, has it changed at all? Has the time frame changed at all when you test negative? Do you have to test negative, or does it just a certain amount of days after you've recovered? How does it work?
So I'm glad that Paul says we're getting more efficient, because I certainly hope so. I know that there have been a number of folks who have been a little bit frustrated with us as we've worked through our process. I'd just like to say that we're doing all we can to become more efficient with the process and to shorten the time period from when you contact us to when that first donation is. So having said that, we'd like for individuals to contact us at least 10 days after their last symptoms, so we can get the process going. If they have a positive COVID test, we will ask them for that test so that essentially we can get them scheduled immediately. If they don't have a positive test for COVID, but they believe that they've had it, then right now, today, we're still testing for the antibodies before we collect their plasma. Also, for women, there's a special antibody that women have, especially if they've had multiple pregnancies, an HLA antibody. And if they have that antibody, then they won't be able to be plasma donors because that antibody could affect the patient. So we also test for that. It's called the HLA antibody. Yeah.
This is, first of all, what are you talking about? Mothers are supposed to have, the golden plasma. What are you talking about? Okay, so that's, that's important.
They do have golden plasma. However, unfortunately, the HLA antibody can cause a serious illness that's called transfusion-related acute lung injury. And so we want to test them to make sure that they don't have that antibody. That's not a good antibody for someone who has COVID to receive.
I'm writing this down because this may be a future story.
Yes, we'll be happy to say HLA, HLA antibody.
I've never heard of anybody who's not, okay, but let's, now that we're on that, who is a good candidate for it, who is not other than...
So a good candidate to start with is anyone who's tested positive for COVID. That's number one.
Okay.
Number two is that they have to be symptom-free for at least 10 days. The next thing is they have to be eligible as a blood donor. So if someone's ever had hepatitis after the age of 10, they will not be able to donate plasma. If they're on certain medications, they may not be able to donate. If they've ever had leukemia, they probably won't be able to donate. So number one, you have to have that positive test or believe that you've had COVID. Second, you need to be qualified as a blood donor.
Okay.
Once we do that, then chances are you're going to be able to donate plasma. Now, when I say that we're getting better at what we're doing, we're actually looking at a process where as soon as people contact us, we'll get them scheduled, we'll get them to come in and donate plasma, and then we'll do all of that testing that I talked about before on the back end, rather than on the front end. But when we started doing this, a lot of that testing wasn't in place, especially what we call high throughput testing, and we had to do it manually, which really backed up the process. So we're working through that, and our hope is that sometime in the very short near future, and by very short near future, I'm talking several weeks, we'll just have people calling and we'll ask them a few questions and we'll get them in to donate because we realize that it's important. Some information I want to give to the community about the importance of convalescent plasma. So we believe that, we've got Labor Day coming up. We've got kids that are going back to school. We've got our more adult children that are going back to college. We believe that there's the potential for there to be another spike in COVID cases, not only here in San Antonio, but across the United States. And so HHS has asked all of the blood centers to prepare for these spikes in
Health and Human Services.
Health and Human Services has asked us to prepare for these spikes. And when I say us, I'm talking about communities, blood centers together, because only together can we do this. So they've asked us to start creating what I'm calling a prudent reserve of convalescent plasma. So meeting the day-to-day needs of our local hospitals, and also creating a stockpile of 4 to 6 weeks worth of plasma. Which here in San Antonio, that's about 4,500 doses of convalescent plasma. Then on top of that, HHS also wants us to help contribute to a national stockpile. So if there's a larger usage in one part of the country versus another part of the country, then together those communities can help support that other part of the United States. And so together all of the blood centers are working towards that. But we can't do that until we meet our local needs. So when Gordon was alluding to the 75 donors a day, that's why those 75 donors a day are so important, is that in order for us to be able to get to a point where we have those 4,500 units ready and waiting for that spike in usage, which we believe is going to happen, especially as we move into the cooler months of the year, we have to have that many donors a day. And that's another reason that we're looking at streamlining our process. This whole thing is so new to all of us. And I wish, I know that people get frustrated with They get frustrated with the government. They get frustrated with healthcare. They get frustrated with the doctors. They get frustrated with us. Quite frankly, we're really good at what we do, but this is really new. Collecting convalescent plasma, doing all of the testing, providing it to the hospitals having to work through all of the paperwork that they have to work through in order for it to be transfused. It's a lot. Besides taking care of these, seriously ill patients. So I know that people get frustrated, but please keep in mind, we're a community working together to make this plasma available for patients. And we will get better. The testing is one example of how we went through manual testing and now we have a high throughput testing. But we've still got processes that are manual that we have to work through as we get better. So, a year from now, it'll be no big deal, right? Donating convalescent plasma, it'll be just like donating a unit of blood. We're not quite there yet. So please, please, we're all working together for the betterment of the patient who's in the hospital.
Let me ask a couple of questions from our viewers here. One person wrote, does patient's blood type have to match the donor's?
So right now, under the Mayo criteria, the Mayo Clinic criteria for the clinical trial, is that they do have to match the blood type. Now, if the hospital wants to transfuse the plasma without being part of the Mayo clinical trial, then the doctor makes the decision. Some blood types you can actually give one type of plasma that is not the same blood type to a patient who has a different blood type. But according to the Mayo clinical trial criteria, it has to be type specific.
Okay. Another person wrote, and this may go to the frustration that you may be hearing from some people. This person wrote, Brad Moore wrote, I called the B&T and received the form within the same day, filled out the form and submitted the form and test results over 2 weeks ago, and I've yet to hear anything. What is the time frame I should expect to hear something?
So they should expect to hear something within, I would say, 7 days. Earlier in the process, when we were doing a combination of manual and high throughput, we're validating our processing. We were having, as you bring on any new system or process, there are hiccups along the way. And unfortunately, it sounds like his test results might have been part of that transition period. So what I would say is that we will do our very best to get those results back to you. If you haven't already heard from us, because we've got your information, we've got your name, we'll look at that and try and get those test results back to you, Brad. And thank you for letting us know.
William is asking, has plasma treatment worked in every case, or are the patients for whom it is not effective?
That's what we're believing that the clinical trial will give us more information about. So when people are admitted to the hospital with COVID, they're in various stages of the development of the disease or the progression of the disease. And so when the plasma is transfused, some of them, unfortunately, may be past a point where the convalescent plasma would have time to work. For other people, they may be so early in the process that the convalescent plasma, the antibodies, have enough time to develop that passive immunity for patients. So the quick answer is there are some patients where convalescent plasma did not work for them. And we're trying to figure out what is the optimal time, what is the optimal dose, and hopefully once we get more information about this, we'll be able to say specifically what that is.
You bring a good point. Paul, your symptoms were relatively mild, you said, but you've been able to give 5, pints of plasma. So does it matter? Is there a difference in stage of illness, those who are on ventilators as to maybe those who are asymptomatic and test positive? Unmute.
Sorry about that. I got muted. Is that a question for Elizabeth or me?
It's for both, because your symptoms were relatively mild, and how long did your symptoms last?
My symptoms lasted about 6 days, 7 days, and then it was
Very short-lived virus for you, and you still waited a good 14 days afterwards before you were able to donate. So Elizabeth, then that question is for you. Is there a difference in somebody like Paul, who has relatively mild symptoms, and somebody who is on a ventilator for 6 weeks? Does the plasma have any less effect in them and more in someone like Paul?
So folks like Paul who have very mild cases, they probably will not be transfused with plasma. These are individuals, the people who are receiving the plasma they're sick enough where they end up in a hospital. This is a blood transfusion. So blood transfusions are not done lightly, and they're done under the care of a physician, believing that this is something that's going to save this person's life. So someone who's been on a ventilator for 6 weeks, I would imagine that most physicians, at least at that point, they would have transfused convalescent plasma by then, or they've got some extenuating circumstance where they believe that it's really not going to be beneficial for the patient. That's why I'm saying it really is a patient, family, physician decision to do those transfusions.
Is a person who is as sick as someone who is hospitalized on a ventilator for 6 weeks, once they recover, is their plasma any more or less effective in somebody else who's fighting it? You know, are their antigens as strong as someone, who is, not as sick maybe?
It's really an individual thing. With some people, it just depends on what their antibody levels are. I would imagine that there could be people who are very, very ill and recover, and their antibody levels are not any different than Paul's. There could be some people that they may be asymptomatic, and they find out that they've got antibodies just from coming in and donating blood, and we tested for them. And we find out that their antibody level is extremely high. So it's how the body responds to the virus that really determines the level of antibodies.
Are people who are more fit, are their antibodies stronger? Is their level better?
We're not seeing that kind of information because we're not capturing how fit are you when you donate blood, how healthy you are, yes, but not.
Oh, that's what I mean. Yeah, fit and healthy. A healthy adult who. Oh, that's another question I had for you as well. Is there an age requirement? Does it matter? Kids get COVID once they recover. Could they donate their plasma?
Because they have to be qualified as a blood donor, they can't donate convalescent plasma until they're at least 16 years of age, and that's with parental consent. At 17, they can donate without parental consent. And someone can donate there's no upper age limit. Mm-hmm. So it's really about being well and healthy. I know that there was a question about someone saying that they had been in the hospital, they had received convalescent plasma, and they were told that they couldn't donate for 3 months, and wondering why that was so. Keep in mind, they have to have the same qualifications as a regular blood donor. This is a blood transfusion. And so we want to make sure that, first of all, it completely recovers from COVID, and that they don't feel weak and like this might affect their health. Second of all, we want to make sure that if they do receive a blood transfusion, that if there's any outcomes from the blood transfusion, that those have time to occur before they donate that blood to someone else.
Here's a question from Ken here. What is the difference between giving blood and giving plasma?
So why don't you go ahead and handle that, Paul, because you've done both of those.
Yeah, I think the only difference is that at the end of the day, when you see in a blood donation, when you see the medical staff walk off with a bag, it has your blood, your full blood in it. And in a blood transfusion where they're pulling plasma out of your body, the only thing in those bags is the liquid gold colored plasma, right? But the blood's back in you. So there's not a whole lot of difference in the way it feels because they obviously put a needle in your arm real quick and very painless. And the time frame is pretty much the same. It's not, I mean, I don't know, what's your average blood taking time?
I thought it was like 10 minutes.
So when someone donates a unit of whole blood,
Mm-hmm.
what I call the old-fashioned way, to just a unit of whole blood, the time that the needle is in the arm is about 8 to 10 minutes.
Okay.
When you donate plasma, because it's an automated collection process, where essentially we work in tandem with technology to extract some of the blood, they spin it down, they keep the plasma, they get the red cells back, and that process repeats itself several times. The period of time that the needle is in the arm is closer to 30 to 40 minutes. So it does take a little bit longer. It is a little bit different process. But I think Paul is right on when he says, when the employee walks away with that unit of convalescent plasma, it's really important for people to understand that's one of the primary treatments right now for people who are in hospitals they are in a serious way. And everyone that we've talked to that has come in and donated plasma, when they leave and we say thank you, I believe they leave with a sense of knowing that they've really done something with their time. I mean, really done something with their time.
Yeah.
When you meet some of these people that come off the ventilators and talk to their families, like what it was like. There's one person in particular, and she talks about she left her husband at the emergency room door, and she didn't get to touch him, see him for 31 days. I can't even imagine what that would feel like, but there's a lot of people out there that do know what that feels like. And to be able to know that they got convalescent plasma and they open those hospital doors and that family member walks out and all of a sudden they can hug them, they can hug their kids, they know that they're coming home. I mean, I can't think of a better way to spend a couple of hours of my day, knowing that that's going to be the outcome for somebody.
I read that the mortality rate in some of the patients was reduced to something like 50%, right? I mean, it's an incredible number, the number of people that this is actually helping.
So the stats are still out, and so I don't want to say something, especially if it's being recorded, that's like, well, what's wrong about that, right? But what we're hearing from families and what we're hearing from physicians and the preliminary results is that it is making a difference in people's lives, that we are seeing people that were on ventilators who were having a very, very poor prognosis. They were given convalescent plasma, and then within 24 to 48 hours later, there was marked improvement. We'll see for sure, but we're hearing a lot of great things.
Well, here, I'll let you off the hook here, and I'll quote the Wall Street Journal.
Yay.
It reads, patients who at 3 days or less after diagnosis received plasma containing high levels of antibodies against the coronavirus had a mortality rate of 6.6% at 7 days after the transfusion. That compared with a mortality rate of 13.3% for patients who got plasma with low levels of antibodies at 4 days or more after diagnosis. That indicates reduced mortality of about 50%, according to the researchers in this article. So, I mean, we're accumulating the numbers. That's why you are involved in this study with Mayo Clinic. And it really seems like, this is the best we got. So, Gordon, over to you. I'm going to pick your brain. When you were screened, what was your level? What was the level range? Do they tell you that? Do you know if you have a lot of antibodies? They let you know that you're a great candidate for it and good to go?
Her numbers, I'm a good candidate. I don't honestly know my numbers though. And so maybe I'm supposed to know that, but I don't know, and I'm sorry, I just don't know. Yeah.
Well, Elizabeth, what are good levels? Like, and does a person receive their level number?
So we don't publish their level number because part of it is the technology to do that. The other part of it is I'm not sure how. We don't really know what a good dose is yet or not with regards to the titer. We know that we want a titer of at least 1 to 80 or higher. We would prefer a titer of 1 to 160. It would make sense. The higher the titer, the better the dose. We're still trying to figure out what that bottom level is. We know that there's been some talk about that the titer could go as low as 1 to 40. So what does that mean? 1 to 40, 1 to 80, 1 to 160? To the average person, I don't know that would make much difference. In a statistical format, we would know that one's twice as good as or twice as much as one, and it's 4 times. So we'll see that. We'll see what happens with that. But right now, it has to be 1 to 80 or higher.
Okay.
For the concentration.
Those levels are best found in someone who has just newly recovered from the virus, as opposed to several months after.
Absolutely.
Okay, so if there are people watching who recovered maybe around fall time, back in April, maybe the spring, or even June, are they still candidates? Can they still come in?
Yes, well, absolutely. We're looking for folks who are newly recovered, because we look at the antibody titer. At least what the science shows is that the antibody titer is as high as it will ever be during that time. Exactly. It's the golden hour, yes. So that's when we want to collect it, when we know it's going to be at its highest level. It doesn't mean that they don't have antibodies, but if we can get a more concentrated dose, because we know that the more concentrated the dose, the better for the patient. That's what the Mayo Clinic study is showing. Then those are the folks that we want to encourage to start donating.
Right.
Once they donate, we will test each and every one of their donations for what their antibody titer is. And when it gets to below the 1 to 180, then we hope that they'll continue to donate blood, but we won't be collecting their plasma at that point.
Gotcha. All right, so in our last few minutes that we have here, I'd like to just go around, and Gordon, I'll start with you. If you wouldn't mind just making a plea to the public, as somebody who has lived through the virus, and is in the process of donating your convalescent plasma, talk to people who are watching, our viewers today, and explain to them why you think it's so important and why it means so much to you.
Well, it means a lot because the benefit is so high for someone giving an hour or two of their time to save someone's life. It's so simple. It's not a question why, it's a question why not? Why wouldn't you do something like that? We all participate as folks that help people whenever they're in need. And I will tell you, San Antonio in particular is a very compassionate city, a very giving city in so many different ways. When they know they need to come to rise to the occasion. And so I think it's just a matter of getting the information out, and opportunities like this allow for that to occur. And my hope is that we'll become more aggressive at getting the word out, because as was mentioned by Elizabeth, 45, you have to come up with 2,500 opportunities to help people. It's going to take an effort to bring a lot of people together to make this happen. So to hear it and say, well, someone else will take care of that, is not an answer to this. Someone needs to take it upon themselves to say, I was blessed in the fact that I survived COVID-19, that I had the resources to be able to feel better now, and for that reason, there are many people who are not as lucky. And when you recognize that, it becomes almost not why do I do it, but why not? Why would I not be involved with it? I'm hoping people will come together in that respect and really take it seriously and know that it's not something to kind of just think about and move on. We all have a certain amount of time in our life, and it's how we prioritize that time, and to prioritize an hour or two of your life to give someone else's life seems like something pretty simple to make, and to quick and easy answer. Yes, I need to participate.
All right. Gordon, thank you. All over to you. Tell us why it's so important. It means so much to you, and why it's so important for our community.
Well, every time you go, and you can go every 5 days, if you can continue to go, you can save numerous lives. So if you're able to give enough units for 5 people in one dose, and you go the second time, you're saving 10 lives. And I'll say, A, that's important. Like Gordon said, you're helping your fellow community member. And I've said this numerous times in front of Elizabeth, but I don't know that there's ever been something I've done that's more rewarding than that. To know that you could be making that kind of impact on your community. And so it's really important that we get the message out. We've been pushing, as much as we can. We didn't talk too much about the nonprofit, but I will say we will be releasing a public awareness campaign that will roll out late this week or early next week through Con Corazon, the nonprofit that you mentioned. And our goal is to get 10% of the people that have recovered to go and donate plasma. And if we can do that, then we'll have enough plasma on hand that hospitals aren't waiting for supply for 3 or 4 critical days as people continue to get sicker and sicker and sicker. And that's my goal, is come winter, we have Elizabeth's biggest problem is where we're storing all the plasma.
Yeah, really stepping up and helping out in so many ways. Elizabeth, I do have a quick question before we leave everybody. Can you guys come to patients like you would for a blood donation? Or is the plasma donation something that you have to do in your facility at the donor pavilion?
So I'm sorry, I'm not following you when you say come to the patient.
And you have your blood mobiles.
Yes.
Can you go out in your blood mobiles to patients instead of, them coming to you?
So we do have blood mobiles, and we're actually looking at some models where we can set up in specific locations that are maybe more convenient for different parts of the city as well as outlying communities. So we're beginning to do that now. It's part of our actions moving forward. So we should be doing, in fact, I think we've got one where we're going to be going to some outlying communities that have been requesting for us to come and visit there. Keeping in mind, we do have limited resources, the number of people that we have available, and so we try to put those resources where we can do the greatest amount of good in the shortest amount of time. So, but we are looking at that right now.
Well, we know we've been doing the Dancing for a Cause event to help you get those blood mobiles in action. Still the top of the line blood mobiles, and I know we couldn't do that dance in the big ball this year, but next year we'll be back at it, helping you guys raise some money. Well, listen, we want to thank everybody today, our panelists, for joining us. What an invaluable wealth of information you have been able to share with the public about convalescent plasma. I mean, I think we've covered it all. So if you don't know everything about convalescent plasma by now, there's one place you can go. That's South Texas Blood and Tissue Center. You can learn all about it. SouthTexasBlood.org is their website. Right now, every plasma donation at the South Texas Blood and Tissue Center earns a $50 Visa gift card from Carrigan Shaw and Wyatt Law Firm. So there's more incentive for you to get out there. If you are unable to give plasma or blood, you can also make a financial contribution to support the Texas Blood and Tissue Center with COVID-19 response and recovery efforts. I mean, you know what this has been like out there in the community. It is just all hands on deck in every way, shape, or form in Bexar County. So thank you to all of our participants. We appreciate you. We value your input. You are just absolutely amazing, the things you do for all of us in our community. So again, as a reminder, this segment's going to be recorded and it will be available at southtexasblood.org website. All right.
Thank you.
Thanks, everybody.
Bye-bye. Thank you.
Have a good day. We'll see you later.
Bye-bye.
Bye.